So this is our patient, 33-year-old male, basically 2 years ago fell from a motorcycle, pain in the left elbow posteriorly. If you kind of feel it, you can kind of feel a gap, and he also has this little loose body that you can feel over here, and you can see it on his x-ray. It looks like he may have avulsed the triceps tendon. No, keep your arms bent. Why don't you come here, just look at the contour, Igor. See this little dent here? I think that's kind of where his triceps tendon should be compared to the other side. So I think that's what he did. He kind of has some weakness with resisted extension. Try to push against me. Push hard.
No, I can't.
So he feels like it's weak. Push this one. Okay, so yeah, you almost got me. Okay.
Sorry.
It's all right. Our first clip, we're looking at the olecranon on the left side of the screen, and then proximal is actually to the right. And you can see basically this big, just kind of defect there, where you would expect his triceps tendon. Here's the shaft of the humerus. And here is this pretty large gap within the distal triceps tendon, essentially disconnecting it. So just kind of empty space. Again, just probably an avulsion. This was 2 years ago. That's why his olecranon probably looks smooth on exam. We're going to go up. And there's that loose body, which you can see on x-ray. All that shadowing underneath it. So here also between this loose body and the olecranon is significant tendon scarring. It's not a normal tendon that has parallel fibers. It's essentially irregular scar tissue. He basically has some scarring in there. Let's kind of look at it in a short axis view. So here, right side of the screen is ulnar, left is radial. Just going to walk our way down the humerus, and we're looking now. And there's that loose body coming into play. Here again is the loose body with posterior acoustic shadowing. You can see some tendon scarring right next to it. There's a little bit more medial for ulnar. And as you go further distal towards the very end of the humerus, you can see the olecranon fossa. Let's just do a comparison view of his other side just to get a sense of what normal looks like. Here, right side of the screen is proximal. So you can see the olecranon here. And again, here's a normal looking triceps tendon attaching on the olecranon. See a nice triceps tendon attaching. And here you can see the medial head of the triceps brachiomusculature just deep to the tendon. And we're just going to go ahead. Right side of the screen is radial. This is also 1452. And here's the lateral head of the triceps brachiomuscle, just next to the tendon as it goes distal. This right side is normal side. And here's just another view. Again, we can see the olecranon fossa diving deep. Just going to walk up the shaft here again. Here's a pretty good layout of the long and lateral heads of the triceps mechanism as they merge into the tendon.